It's been about 13 months and a couple of weeks since we first heard about new viral pneumonia spreading in China, and now we are starting to see some, but not really all that much resolution on just where the coronavirus that causes COVID-19 originated from. Anjalee Khemlani joins us now with the latest almost findings. Anjalee, coming from the WHO this morning.
That's right, Miles. I mean, at least what we got out of them is some theories put to rest. And one of those is obviously the lab leak, whether or not it was in Wuhan or anywhere else in China. That has been largely debunked by the WHO team, the WHO/China team, as well as the idea that it was a direct jump. The virus directly jumped from, say, a bat or pangolin to humans. They are saying that there is likely now either an intermediary host or, as well as some sort of role possibly of the cold chain of transferring meats to play a role in that. We know that the virus survives a lot better in colder environments, and so that they're still learning about that and still looking to see where exactly that original source is. What they did also reveal about the spread, while we do know that Wuhan was the central hub, a lot of it has been focused on the Wuhan market, but they're saying that it isn't the Wuhan market specifically that was the source of the spread, but Wuhan at large has been responsible. And they're also looking at outside of that, whether or not globally there is some sort of other connection. So looking at where else in the world some of these cases were showing up, like in Europe, around the same time as China, to kind of understand. So that's a little bit more clarity, though the experts did say there's nothing very specifically new, but there is still more to be done to learn. So that's where it stands right now. We've got a little bit more clarity, still do not know where this virus originated.
So even as the research is continuing on that side, give us an update on what's going on here in the U.S. because, gosh, the vaccination efforts have been uneven, haven't they? What's the latest right now?
They have been, and they continue to be, but the one sort of slightly good news is that we know that of the vaccines that have been shipped, a majority have actually now been administered. So about more than 59 million have been distributed, and more than 40 million have already been, 42 million specifically, have already been administered between first and second doses. So that's really good news, but we know that there's still a long way to go when it comes to the ramp up of vaccine production. We're still waiting for the end of the month to hear about Johnson & Johnson and what happens to their vaccine in the Vaccine Advisory Committee meeting. But we also know that the federal government has recently said that it is working with Pfizer to help increase production, and that Pfizer itself has said in a recent report that they are going to be able to increase production and cut the time to distribution by about 50% in coming months. So that also bears some good news. Meanwhile, we're watching cases, deaths, and hospitalizations all trend downwards. This is all really good news. But of course, all eyes on yet again another possible spreading event through the Super Bowl. And so that's something we have to keep an eye on 2 weeks from now, whether or not that did indeed end up an event, because we do see that the variants that continue to spread are of concern because they're transmitting so much faster. Experts are worried about whether or not that will actually be a source of spread continuing forward.
All right, Yahoo Finance's Anjalee Khemlani with the latest on all of the goings on the coronavirus front this morning. Anjalee, thanks so much.